Great. Thanks for folks. Why don't you come on in? We'll get started. We want to be prompt. I feel like this conference has been really good about being really prompt and starting on time, so I don't want to ruin their track record on that. Good afternoon. My name is Nastasia Walsh. I am a program manager at the National Association of Counties. I manage our Stepping Up initiative. Are folks in the room familiar with the Stepping Up initiative? Just one, as you should be. Great. Good. This is good because that means that all of this information I'm giving you is new, and so it won't be a repeat for you. So I'm going to talk about Stepping Up today, and then we have Commissioner Hall here from Lincoln County, and Commissioner Joplin from Hood River County is going to join us in just a minute. She's introducing another panel at one of the other meetings that are going on right now, so she'll be here very shortly. So I want to give sort of a national overview. Are folks familiar with the National Association of Counties really fast? Great. All of you should be familiar. Oregon is 100% of the counties in Oregon are Stepping Up, our National Association of Counties members, and so we appreciate all of your membership, and then I don't have to talk about what NACO is and what we do. So what I want to talk to you about is mental illness in jails. And how many of you, one more quick hands up, how many of you were in the meeting yesterday about mental illness in jails? Okay, so quite a few of you. So I was in that meeting too, and it was really, really interesting, and I'm glad that I got to be a part of that meeting. I think today is going to be a little bit different, not just because we're going to talk about this national initiative, but also because I think we are going to spend a little bit more time sort of talking about the process for how you move forward with reducing mental illness in jail. So less about sort of best practices and what's happening in the counties that we're working with, and more about how does your county in particular get there? How do you get started? How do you move forward with your own initiatives? And how do you move forward with reducing mental illness in jails? And so I promise this will not be a repeat of yesterday's workshop that we had. So just some national numbers just to get us started. So we know nationally that about 5% of the general population in the U.S. has a serious mental illness. So this is going to be your bipolar disorders, schizophrenia, and related issues. But we also know that nationally, about average is about 17% of people in your jail population have a mental illness. And I'm sure a lot of the folks in this room would say, you know, that's higher in my county. Maybe a few of you would say that's lower in my county. One of the challenges that we're facing is that this data is from 2002. We don't have a lot of really good data, especially national data, about what's happening with the number of people with mental illnesses in their jails, and so we're going to talk a little bit about that. We know that about 11 million people are admitted to county jails every year. About 2 million of those has a mental illness, one of those serious mental illnesses. Like I said, 17% of your jail population, and then about 3/4 of those has a co-occurring substance use disorder, which we know is also a major, major issue. So why is this happening? Now, I'm sure if I polled the room, you would give me some reasons about why this is happening. We're seeing sort of some main trends across the country. One is that people with mental illnesses are arrested at disproportionately higher rates than people without mental illnesses, and usually for low-level crimes, right? Loitering, trespassing, public intoxication, disorderly conduct, things that are really more of a manifestation of their mental illness than something that's violent or are really disturbing folks. Once they are admitted into jails, they tend to stay longer in jails or prisons than people without mental illnesses, and this is for a number of reasons as well. One, really big challenge is that a lot of people with mental illnesses are homeless or do not have stable housing, and so it's hard for a judge to release someone to the streets. The other piece is bail. Even $500 bail is a huge issue for someone who is homeless or does not have a job. $500 may as well be $1 million. And so we see a lot of folks who are staying in jails for longer. The other piece of that too is sometimes if a person goes into jail, they're not on their medications, they're in psychiatric crisis, they're behaving in ways that are causing folks in the correction system to think, they're dangerous, we can't release them back into the community like this. We're also seeing limited access to healthcare, and so people who are not enrolled in healthcare may not be on their medications. They're not connected to treatment services, and so they're going back and forth through this cycle. Speaking of cycles, higher recidivism rates. People with mental illnesses have higher recidivism rates, higher rates of rearrest than people who do not have mental illnesses. Low utilization of evidence-based practices. So we know that there are a ton of evidence-based practices out there and best practices out there that counties are utilizing. But one of the challenges that a lot of counties face is, one, implementing those to a scale that's really reaching all of the people that you need. You know, we have a mental health court. It's a great mental health court. It's serving 10, 20 people a year, but really we need 40 or 50 people a year to be enrolled in this mental health court or in this other treatment program. And so making sure that these are to scale and making sure that they're implemented with fidelity to the model so that they are a good evidence-based practice. And finally, more criminogenic risk factors. And I feel like we've talked about a lot of criminogenic risk factors over the last couple of days. But what we're seeing a lot is, people with mental illnesses have more of these risk factors that make them more likely to engage in criminal behavior. They don't have a job. They don't have, positive leisure activities or positive peers. They're more likely to have negative peers or substance use disorders or things that'll make them more likely to engage in this activity. One thing that is really important to note that we didn't really talk about a lot in this at this is that mental illness itself is not a criminogenic risk factor. There's no research that says that someone who has mental illness is more likely to engage in criminal activity or violent activity than someone who does not have a mental illness. Now, when you couple that with a substance use disorder, then that becomes a criminogenic risk factor. That makes a person more likely to engage in this behavior. And so we see a lot of media out there about people with mental illnesses and some of the egregious, violent behaviors that are happening, but that is very, very, very rare. People with mental illnesses are far more likely to be victims of a crime than they are to commit a crime. So because of all of these reasons, the National Association and its partners, the National Association of Counties and its partners at the Council of State Governments, Justice Center, and the American Psychiatric Association launched the Stepping Up initiative in May of 2015 as a way to really elevate this issue to the national level. We know that counties have been experiencing this for decades, but really wanted to sort of elevate the conversation, bring it to the national level, raise it to the federal level, the state level, and county level as a way to really start talking about this issue. And so it is a national initiative. In addition to the three partners, we're funded largely by the U.S. Department of Justice, Bureau of Justice Assistance. We also receive funding from other private sponsors, and we partner with a lot of the folks who you all are probably memberships of. The National Sheriff's Association, the National Accounting, I always mess up the NACBID, the National Association of County Behavioral Health and Disability Directors, NACBID. As well as a number of other DC acronyms that I won't try and spell out right now. But, the National Alliance on Mental Illness, NAMI, is a strong partner of the Stepping Up initiative. And so we try and bring all of the resources that they bring, as well as, what we bring and what you all bring to the table to try and provide resources for everyone. So what do we do? So right now, the Stepping Up initiative has really launched a call to action to bring counties to sign on to the initiative by passing a resolution or a proclamation to join the initiative and commit to sharing their lessons learned, commit to starting a planning process for getting started or enhancing initiatives that they already are doing. We know that there are some counties in here who have been doing this for decades or at least a few years, and there's some counties that are just starting out. Blank state just decided we're going to start doing something about this. And so this call to action is really for all counties to sign up. And we have, as of yesterday, while I was at this conference, I got resolution number 328. Which is more than 10% of the U.S. counties. We have 3,069 counties in the country. These 328 counties are represented in 42 different states. They represent more than a third of the U.S. population. And so we're very excited to have folks signing up. And back in the back of the room, we have some template resolutions. If your county hasn't signed up, we can get you involved. One of the things that I think is important to note is sort of the makeup of the counties that are joining Stepping Up. And so sometimes people think of this as an urban problem. Yep, in the urban cities, you know what? We see a lot of homeless people. We see a lot of people who are quote unquote acting crazy on the street. You know, maybe we don't see that so much in our rural counties, but we've actually had 44, 45% of the counties who have signed up are smaller or more rural counties, less than 100,000 population, folks like, the folks here on my panel. And so we know that this is not a big county problem. This is not a small county problem. This is an every county problem. And so we're really working on solutions to bring every county together and identify some strategies that will work for all of you. We have seen 12 counties in Oregon so far have joined the call to action, and I know with Commissioner Hall and Commissioner Joplin and everybody in the room, we're going to see a lot more of you joining the initiative, and we really hope to have you here. So thank you to the 12 who have joined so far. If you don't see your county's name up here and you know that your county has passed a resolution, my card is in the back. Make sure to send me an email so I can make sure that you're listed on here as well, because we don't know if you passed a resolution unless somebody tells us that you did that. Here is the Stepping Up website. You can go to stepuptogether.org. You can, in addition to the papers that are in the back, you can get a copy of the resolution there. You can get a list of the counties across the country that have joined, and get a number of resources as well. So as we're sort of getting started, we know that passing a resolution does not actually solve everything. You can't just pass a resolution and then your problems are solved here. And so what Stepping Up has done is really sort of created a framework for helping counties to get started or enhance their efforts for moving forward. And so earlier this year, actually last month, just a few weeks ago, we released a new report called Reducing Mental Illness in Jails, 6 Questions That County Leaders Need to Ask. And what this report does, it doesn't give you a list of all of the best practices out there, but what it does is sort of create a framework or a process for helping you move forward. And it sort of leads with, how do you know if your county is ready to start reducing mental illness in your jails? And it goes through these 6 questions and it asks county leaders to sort of look at these questions critically and start thinking about your responses. And so I just want to go through them very, very quickly so that we can get to our 2 esteemed commissioners here. So the first question is your leadership committed? Have you passed a resolution? Do you have a champion on your board? What about a judge? Is your sheriff on board? Is your county behavioral health director on board? Do you have folks who are really committed to addressing this issue? Because we know if we don't have champions, it's not going to move. It's not going to move. It's not going to work. Do you have timely screening and assessment? This goes to number 1. If you can't identify the people who have mental illnesses in your jails, how are you going to know what your problem is, how you're supposed to move forward, and whether you're making significant changes if you can't really identify folks who do have mental illnesses in your jails or in your systems? Do you have baseline data? Data is tough. Data is really tough. We get a ton of questions about data as we move forward, and so if you don't have sort of that baseline, you know what, on January 1st, we had this many people with mental illnesses in our jails. If you don't have sort of that baseline, it goes back to that screening and assessment. If you don't have that baseline, how are you going to know if you're getting better, if your efforts are having any sort of impact at all? And then you can use that data to sort of decide, what are we going to do to move forward? You know what? I want to create a mental health court, but we don't need one that serves 40 people because we really only have 15 people who would be beneficial to this. Or we have 15 people who need this, but we only created a mental health court for 10 people, and we need more. So looking at your data is going to be very, very important. Have we conducted a comprehensive process analysis and system inventory? Are folks familiar at all with the sequential intercept model? Nobody knows about the sequential intercept model. We'll do another presentation on that on another day. But basically, doing a systems analysis is a way of mapping out your system and looking at each different point that a person touches the criminal justice system. First might be arrest. A person, meets with law enforcement. What can you do at that point to intervene, whether it's diversion, whether it's moving them to a different place, whether it's taking them to jail. What can you do at each point along your system? And it doesn't have to be the sequential intercept model, but looking at sort of mapping out your system and seeing at which point people are touching the system, at which points can you intervene to keep people with mental illnesses out of your system. Have you prioritized policy, practice, and funding? So once you figure out, you know what, this is the data, this is what we have, this is what we know, these are the systems that we have in place already to help divert people, this is where we're really having some log jams, this is where we're having some gaps, then you start getting together, and this is the tough part. I mean, they're all kind of tough, but really it's tough to prioritize. Where do we start first? What can we do now? What are some of our short-term goals? What are some of our long-term goals? Where do we want to prioritize our funding right now? Where do we need to look for funding that's outside of the county budget? Can we get a federal grant for that? Can we get some money from the state from that? Can we get a private foundation grant? Where do we need to ask the county for money? And how are we going to prioritize the things that we're going to do? And lastly is the thing that everybody has good intentions about and everybody doesn't have time to do, which is track your progress. We've implemented all of these things. We're doing some cool programs. We've got our mental health co-responder program in sight. How are we tracking progress? How are we tracking who is still in our jail, who we're diverting, and how are we moving forward? And one of the things that I think is really helpful is to think about your progress and your data in 4 different buckets. So one way to think about sort of moving forward is how are the efforts that we're going to do impacting one of these 4 outcome measures. So are we reducing the number of people with mental illnesses in our jails? Are we shortening the length of stay for people who have mental illnesses? Are we increasing the percentage of people who are being connected to treatment? And then are we lowering their recidivism rates? And if you can impact one of these, much less 4 of these, which is obviously optimal to impact 4 of these, if you can impact one of these, then you're gonna see some real progress in what you're doing. If you're reducing the number of people who are coming into your jail, obviously that is going to have an impact on how many people are in there. If you're reducing the number of people who are coming back into your jail, you're going to see an impact. So the optimal is obviously gonna be, let's work on all 4 of these. But if you can impact just one, and maybe that's where your focus is. Maybe the focus is, you know what, we're gonna do crisis intervention team training for all of our law enforcement. That's going to reduce the number of people who are coming into our jail, and that's where we're gonna start. So it's sort of I wouldn't say easy, but sort of a quick way to think about the different efforts that you're doing is to focus on one, if not all of these 4 measures. And we know that this is not easy. Through Stepping Up, we have a number of resources available to help you actually implement these things. And so, up on our website, it's stepuptogether.org/toolkit. You can see archived webinars as well as new webinars. We have a network call in the next 2 weeks, and we'll do another webinar in early April about screening and assessment. We have the networking calls, which are next week, like I said. We have county examples and case studies. I am the person who is always calling folks and asking them, what are you doing? What can I write up in a 2-page case study to sort of summarize what you're doing and share with folks? The number one question that I get, and I get all the emails about Stepping Up, is, do you know any other counties who are doing what I want to do? And so I'm happy to field those, but I need to know what folks are doing in order to do that, so please be in touch on that. We also have a number of planning resources and research available up on the website. This is sort of a quick summary of what I was just saying about the webinars. You can register for those on naco.org/webinars. The dates are up here. There's, like I said, one on March 2nd. There's one on April 6th. We're also hosting quarterly network calls, and these are actually smaller sub-networks of the larger Stepping Up network. And so on March 10th, for example, we are having a Stepping Up network call just for rural counties. And so all of the rural counties will who have signed up to join this listserv will join the phone call and be able to talk to each other and talk about issues that really are just for rural counties. We don't need Los Angeles County on our rural network calls. If you have 30,000 people in your population, hearing what this 10 million population county is doing isn't necessarily going to be very helpful or very relevant to what you're doing, or vice versa. And so we wanted to create a way to really bring folks together with like counties and create an opportunity for that. And then the last thing that I want to talk about before handing it over is the U.S. Department of Justice, Bureau of Justice Assistance just dropped a solicitation, I think it was last week, called the Justice and Mental Health Collaboration Program Grant Solicitation. And so they have 3 different categories this year to help counties who are interested in reducing mental illness in jails. The first one, Category 1, honestly, is basically doing that 6-step process that I just discussed. And it's sort of paying you to help you do that and move through that process and go through the planning process and then start implementing some of the programs that you all have prioritized. Category 2 is just for law enforcement agencies that are looking and partnering in their mental health with their mental health agencies. And then Category 3 is for implementation and expansion. So I want to implement a mental health court, a mental health co-responder program, telepsychiatry. I want to start a new database or program that's going on. And so these are all due on April 4th. I would strongly encourage folks to check out the application. The website's right there that goes directly to the application is what I wrote up there. Rural counties, are there rural counties in the room? So we got a lot of rural counties in the room. One of the priorities for JMHCP right now is on rural counties, specifically on rural counties that are either partnering with the state or partnering in sort of a regional way. And so rural counties are getting priority consideration right now. If you have some sort of proof that your leadership has committed to participating in this initiative, whether it's stepping up or sort of have a formal commitment in place to reduce mental illness in jails, you are also getting priority in there. It's written in the solicitation. So not to force you, obviously, but want to encourage you to sign up for stepping up as part of that, and being able to put that in your application is stronger too. This is just the website, so if you want to sign up, we do have regular updates where we send out things like those funding opportunities, the webinars that we're doing, and any other updates through Stepping Up. I promise we don't send anything more than once a week. It's not too bad. Nobody wants too many emails in their inbox, but I would strongly encourage you to sign up or have your staff sign up to keep updated on what we're doing. This is my information. My card is in the back, and as well as some reports and some information about the initiative. If you have any questions, please feel free to reach out. And then I'm going to pass it over to Commissioner Hall, who's going to talk about what they're doing in Lincoln County.
Thanks very much. And also I'm going to talk a little bit from the statewide perspective, because in addition to being in my 13th year now as a Lincoln County Commissioner, I am serving as president of the Association of Oregon Counties this year. And each year the president selects a presidential initiative, you know, sort of like a pageant winner selects their platform for the year. And I thought there was no better subject than focusing on justice reinvention, and specifically on stepping up. You know, yesterday in a couple of the presentations, I heard discussions of deinstitutionalization. I think it's important to acknowledge another reason that we are facing the crisis with mental health as severe as we are. This is based on a survey from the Association of Community Mental Health Programs, basically our county mental health directors, conducted just last year. And you probably already know this, but just to hammer the point home, we've got a badly underfunded mental health system in Oregon. The estimate was we've got about 50% of the addictions treatment capacity we need, 25% of the mental health treatment capacity we need, and this is just for the 25% of the population who are clients of the Oregon Health Plan. And so I look at Stepping Up as one more platform, one more opportunity to work on building an adequate system. You know, certainly that's not going to happen overnight, especially given the current fiscal crisis we're dealing with in Oregon right now. But we have to keep making our legislators and the governor aware of this problem. We have to keep working on progress. It's a crisis, but it's also an opportunity. You know, despite the challenges Oregon has been facing, we have seen some positive things. Senate President Peter Courtney wanted to make mental health a priority a couple of sessions ago, and so there was some significant new investment in senior mental health and children's mental health. Stepping Up, as soon as I learned about it, I saw what a wonderful opportunity, and even though I think Stepping Up accomplishes a lot of great things, the best thing in my experience so far is the counties that have really embraced this. It's bringing behavioral health and public safety systems into alignment in a way that has not happened before. And it does tie into other problems the state is facing. No doubt a lot of you are aware of the problem with the some refer to it as the 370 population for the ORS chapter, others the aid and assist population. But a few months ago, I attended a meeting with Oregon Health Authority officials and the 5 counties who are the largest utilizers of the state hospital. Does everybody know the term aid and assist? Is there anybody who doesn't? Okay. So somebody goes to the state hospital for an evaluation on aid and assist. Lynn Saxton, the director of the Oregon Health Authority, pointed out the average length of stay for an aid and assist patient is 66 days at a cost of $1,000 per day. And she said, you know, a year of housing, treatment, and supportive services in the community would cost a lot less than that. So I think at the highest level, the people in charge at the state get this, but we just have to show them at the local level, at the county level, where the services are delivered, that we can do this. So I think Stepping Up is great from a lot of reasons. You know, it gives branding and focus, and I'm an old media guy. I was in radio and newspapering before I was elected a commissioner, and I think having a focus like this is very good, not only for our direct partners, but hopefully building awareness and some positive momentum in the community, increased collaboration, and then, of course, the sharing of best practices, all the resources that Nastasia talked about. Lincoln County, I took this on about 6 months ago. We've adopted the resolution. We hired on a consultant. We've been working for about 6 months, bringing people to the table. Luckily, you know, we already have a strong mental health subcommittee of our county local public safety coordinating council, and we've been able to use that as really the main gathering table for the key players. We had to encourage a couple of other folks to come in, but most of the folks we needed were already there. Talk about the need in Lincoln County. You know, we heard the national statistic of 17% of folks in jail and prison having mental illness. Our jail counselor in Lincoln County, he estimates that 30%, on a typical day, 30% of the folks that we're housing have been treated for a mental health diagnosis, and 1/3 of that group have a diagnosis of a serious and persistent mental illness. So we're in a community that needs this. We already do have pieces in place and are getting more in place. We've had a mental health court in the county since 2010. We have had one full-time jail counselor since our current jail opened in 1992. We secured a federal grant late last year, and now we're gearing up to staff and operate our first mobile crisis team. We also acquired funding, and for the first time, we're going to have mental health crisis respite housing available. And specifically through Stepping Up, one thing that we focused on, because first, we think it's going to be valuable and it was achievable, and something achievable fairly quickly is to bring in mental health first aid for law enforcement. Already, Sheriff Flanders has made a commitment to accelerating CIT training for his folks, but we looked at this, and the goal is within a year to have all his people trained on mental health first aid. It's, of course, mental health first aid only being a one-day course is not as comprehensive as CIT, but it's a way to at least get some basics to everybody very quickly. We heard about sequential intercept mapping. I loved what I heard somebody say today. It kind of looks like a football field, doesn't it? And running a playbook. But, if you're familiar with process mapping of any kind, this, I think, will be very valuable. We have made this our next significant goal in Lincoln County that we're hoping by this spring to have in place a plan to bring in someone who can take us through this exercise. And then after that, we're looking at going after one of those BJA grants. So, the awareness is already there, the momentum's there, and this has been, to me, a great booster or accelerator. Commissioner Joplin, I'm happy to hand off to you now.
Thank you. I'm going to stand up and come over there to the corner. Can you tip the computer a little bit? Perfect. Thank you. Boy, am I lucky. The last speaker, the last session on the last day. Right? Good spot. Thank you for sticking it out. So the Stepping Up Initiative. So Hood River County, so I'm Karen Joplin, Hood River County Commissioner, and we have a regional jail in our facility that we share between 4 counties. We shared in building it, and now we share in funding it. So the counties are Hood River, Wasco County, Sherman, and Gilliam. And all of those counties together, the population might be around 50,000, give or take, with Hood River and Wasco being the 2 larger populated counties. The Norcor facility is located in Wasco County. So, get my thing pointed the right way. There we go. So in July of 2015, I invited the National Institute of Corrections to come to our region and help us work through a sequential intercept mapping initiative. And they were offering cost-free technical assistance to come out and do that. It was fantastic. All I really had to do was get everybody into the room for a 2-day workshop. I highly recommend it. There's currently a request for applications out from Policy Research Associates, and they are offering the exact same cost-free technical support to come to your community and help you move through a sequential intercept mapping process. I think those application deadlines are February 24th, so no time to waste if you're interested. I think Nastasi could probably help with making connections and getting the application. The application is not daunting, it's quite simple, and again, it's cost-free. You literally, all you have to do is get people together in the room. So I pulled together 38 community leaders out of the different 4 counties, and being that we are 4 counties, it's kind of interesting. We have 4 sheriffs, 4 DAs, lots of judges, so 4 of everything. So in a lot of other municipalities, when they're working with a jail, they're only working with 1 of each of those things. So our challenge was, although they were rural and spread out, we had 4 of every type of decision maker in the room. So after we completed our sequential intercept map, we were able to discern, as you can see on the left, under intercept 1, we were able to discern the needs, the gaps in our services, and then the work to date, the work that we've done in our community since then, after identifying those gaps. You can see I've listed on the right. So I won't go through every one of them. I'll just point out a couple of them as you can read the slide. We were really looking for alternatives to jail for those that were struggling with mental health crisis and needs. And we really were coming up empty-handed, overusing our ER, overusing our jail. So in response to that need, our community mental health program applied for some state-level grants to create a mobile crisis team that is literally mobile, travels with law enforcement, or will meet them out in the field to alleviate and stabilize some individuals in mental health crisis and help come up with a case management plan to help them access services and they do not end up going to jail or to the ER, and that's been quite successful. Assertive community treatment, and if you're familiar with ACT, it's a high-intensive case management system to keep those with SPMI stabilized in their community through ongoing touch points and monitoring and assistance so that they're not accessing our safety net services. And then we have some jail diversion monies that we utilize to embed some mental health counselors in the jail and to also utilize a psychiatric nurse, which can do prescribing in the jail facility and better serve those that are currently in jail and will be coming out, and what can we do to stabilize them and keep them in the community and not recidivate. Intercept 2 and 3, I kind of pushed together, and all of our work to date, we, again, as everybody, we need more resources and we can do better and we can make improvements, but these are just the tidbits that we've done thus far. Intercept 2 and 3, we worked on creating some screening and assessment inside the jail during booking and after booking, really determining what these individuals were needing, whether it was parenting, alcohol and drug, mental health, behavior therapies, really identifying the best pathway of therapy inside the jail to best serve them. We need long-term stay treatment and care planning. While they're in jail, we didn't have anything going on while they were in jail, so we have implemented the screening tool, LSIR screening version, which assesses their needs. They're placed into a program that is embedded in the jail, divided into the 4 different sectors: anger management, substance abuse, parenting. And these are 30-day programs. They have an actual graduation. People get a certificate. It's meaningful. These programs and the counselors that are embedded were paid for by our JRI 3194 money, just state money from the state, of which is under jeopardy right now in session. Intercept 4, we needed to work on re-entry connections as people were exiting jail. We didn't have anything in place to help them engage with services, to help them engage with their primary care doctor or seek a dentist or get their prescriptions filled, have counseling sessions set up before they exited so they had appointments and they had available transportation and child care resources to eliminate obstacles that would prevent them from accessing resources. We now have some case management taking place inside the jail that involves community mental health, the corrections representatives for parole and probation, the NORCOR case management team, and the TRIA referral coordinator that helps determine what references are in need for that particular individual. We're also implementing the Pathways program, which is a model, an evidence-based model that's really focused on outcomes, successful outcomes, and incentivizes successful outcomes with payments. All of these things, again, we need more resources. We need to bolster those services, make a stronger warm handoffs to community resources, and we need to create, in our area, we need to work on creating some pretrial services to bridge the gap of information from what's taking place at the jail to what's being decided in the court. So we need a pathway for information for our judicial decision makers. That's something that we're currently really working on. Intercept 5. The barriers to our successes are limited housing. I know that's common everywhere. Finding places for these folks to stabilize and live once they re-enter our community. We were suffering from delayed substance abuse services. Entry points were challenging. People didn't want to go. They didn't want to go to the community mental health program. And so we had lots of different barriers of trying to get seamless transition into community-based services for substance abuse. Employment, couldn't find jobs. We had really high caseload for our corrections departments. These were the things that we clearly could identify as gaps in our service. So the work that we've done to date, our Wasco County has been able to invest in an additional full-time community corrections officer and to alleviate some of their caseload burden. In Hood River County, we're piloting a community-based supervision alternative. It's a smartphone app called The Guardian. It uses a geofence system to monitor those on probation and parole. Our $3194 have been used also in multiple counties to hire in-house behavioral health services inside the community corrections departments. And again, we're still looking for more resources and stronger service connections for reentry and stabilization services for the population. So here's a slide that shows some of the numbers that we have seen move already with some of the work that we have done. On the left-hand side, you can see our average daily population in 2014 was around the 120. We're currently running around 114. It's not a large movement, but there's some movement. In 2016, in January, we had 45 individuals on average diagnosed with a mental illness. December, the end of the year, 2016, we had moved that down to 19. Our medium high-risk 30-day treatment program is showing results, and out of 246 individuals that were qualified for the program, 147 were placed in a control group. The rest, 86, completed and graduated. Their recidivism rate is showing at 33%. The control group recidivism rate is at 45%. So we are showing a trend that we're hoping to see continue. The 2014, 15, and 16 recidivism rates overall for the jail, you can see, started at 75, 71, and down to 64. So we are seeing a trend, and we're hoping that that will continue. We're hoping to show success so that we can garner more resources to invest internally in the jail and also to connect to our services in the community. And I included this. This is an email from a user of our jail, an experience that they had, and it was an email that came back to the jail, and I don't know how often you see something like this come back. So take a moment and read the letter. The experience was had by an individual in the last few months at Norcor. And I think what this really shows is that the reform efforts taking place inside our jail, including the therapies, the programs, the screening, is changing the way the jail staff interacts with their inmates. They're becoming more trauma-informed. They're becoming more rehabilitation-oriented. And I think that is represented in this experience that this individual had. And I listed my name up there and also my jail administrator, Brian Brandenburg, who's in the room. If you have any questions or would like to know how he's implemented some of these things in the jail. We also had Hoover County Sheriff Matt English stuck it out for the long haul too with me. Thank you. So that is my presentation, and thank you for sticking it out.
Great. Thank you guys so much. We wanted to open it up to questions. If anybody had any questions for the commissioners or for myself. One question that I did want to ask, since we do have two elected officials here, one of the questions that I get a lot from folks across the country is, how do I get my elected officials involved? How do I get you to pass a resolution or get you involved? You both are sort of champions for this issue. But I'd be really interested, I don't know if this is something that folks in the room struggle with, is getting your elected officials or your folks really to take on this issue as a big issue in your county. So I don't know if either one of you has any tips or ideas.
My thought would be just to get some one-on-one FaceTime, bring it to them, bring them the toolkit, show them the website, and make the case.
My situation personally was that our county was going through an incredible budget crisis and not able to afford the jail. Being that it was regional, like I explained, our relationships with our neighboring counties were just blowing up as we were trying to determine how to fund this thing. The costs had continued to increase. The money comes straight out of our general fund. It was a painful budget process to go through. So I became involved on the cost element and what could be done to potentially reduce costs of the jail. And through that, I learned all of these different processes about criminal justice reform efforts, how to better use your jail more effectively, more efficiently, and in the long run, it does save you money. It saves you money not only in your jail system, but it saves you money in other safety net systems that counties are also responsible for.
Great. Any other questions? Everybody wants to go start their 3-day weekends? Okay. Thank you so much for coming. We appreciate it. Thank you to our speakers. Have a great weekend.